9 early signs of dementia that often go unnoticed, and 13 classic symptoms you need to know. Could memory lapses signal something more concerning than just typical aging? Have you considered if dementia can be prevented and how to recognize its early indicators? Today, we'll answer these vital questions. Dementia affects millions of people worldwide, yet many still mistakenly believe it's an inevitable part of getting older. But is that really true? In this video, we'll dive into what dementia truly is, explore the most common types, and outline 9 early signs that could indicate its onset. Additionally, we'll discuss 13 classic symptoms and share effective strategies for maintaining cognitive health. Imagine if you could take actionable steps now to preserve your brain function. Watch until the end to discover the latest advancements in dementia treatment, offering renewed hope to millions. So, what exactly is dementia? Dementia refers to a group of symptoms impacting cognitive functions such as memory, language, reasoning, and behavior. It arises due to the damage or loss of nerve cells in the brain, interfering with one's ability to handle daily tasks. It's not a single disease, but rather an umbrella term, encompassing significant cognitive decline. While dementia is more common in older adults, it is not an unavoidable part of aging. It's a condition that requires proper diagnosis and treatment. Spelling the myth. Dementia is not simply aging. It's essential to clarify that dementia is not a natural part of aging. Although the risk of dementia increases with age, the majority of older adults do not develop it. Mild cognitive changes, such as occasional forgetfulness, are a normal part of aging. However, dementia involves a more profound decline that disrupts daily life. Therefore, we shouldn't assume memory lapses or confusion in older adults are always normal. If concerns persist, seeking a medical assessment is key for an accurate diagnosis. The 4 types of dementia everyone should know. Dementia exists in several forms, with Alzheimer's disease being the most widely recognized. Alzheimer's is characterized by memory loss, language challenges, and gradually changing behavior patterns. Vascular dementia, another type, results from brain damage due to circulatory issues, often from strokes. Lewy body dementia presents with cognitive fluctuations, visual hallucinations, and Parkinson's-like symptoms. Frontotemporal dementia, meanwhile, mainly impacts personality, behavior, and language skills. Understanding these types is vital for guiding the most effective treatment approach. 9 early dementia signs that can easily go unnoticed, yet are crucial to recognize and address. Struggling with words. Difficulty finding the right words during a conversation may be more than just a momentary lapse. It can signal early cognitive decline. Struggling with words often goes beyond occasional forgetfulness. The person may hesitate frequently, rely on vague terms, or substitute inappropriate words that don't quite fit. Over time, this starts to interfere with communication, leading to frustration and social withdrawal. Changes in the senses. Sensory changes, particularly in vision, hearing, smell, and taste, can serve as subtle but important indicators of dementia. The person may experience difficulty recognizing familiar faces, misjudging distances, or having issues with hearing conversations in noisy environments. Taste and smell changes may also affect appetite and nutrition. Lack of motivation, known as apathy. Loss of motivation is another early sign of dementia. The person may become less inclined to engage in activities they once enjoyed, neglecting hobbies and social events. This can be mistaken for depression, but apathy in dementia lacks the sadness typically seen in depression. Muscle weakness. Muscle weakness, particularly in conditions like vascular dementia and Lewy body dementia, may signal early cognitive decline. This could manifest as fatigue, difficulty performing fine motor tasks, or an increased risk of falls. Getting lost in familiar places. Spatial disorientation is often observed early in dementia. A person might get lost in their own neighborhood, or have trouble navigating their home, leading to frustration and anxiety. Sleep problems. Sleep disturbances, such as trouble falling asleep, frequent awakenings, or excessive daytime drowsiness, are common in dementia. a phenomenon known as sundowning, which involves increased agitation and confusion in the late afternoon and evening, is also frequently observed. Hunched posture and difficulty walking. Early signs of postural changes and walking difficulties may include a hunched posture or stiff muscles, especially in Lewy body dementia. As the condition progresses, walking may become slower or unsteady, increasing the risk of falls. Simple tasks becoming complex. Routine tasks, like preparing a simple meal or paying bills, may start to feel overwhelming as dementia progresses. The person may forget steps or become confused, leading to mistakes and frustration. No interest in talking. Apathy or anhedonia may also manifest as a lack of interest in socializing or talking, even about activities they once enjoyed. This can affect relationships and lead to social isolation. The 13 classic symptoms of dementia you need to recognize. Difficulty following conversations. The person may struggle to keep up with discussions, particularly in noisy environments. They may lose track of the conversation, causing misunderstandings and frustration. Loss of time awareness. Temporal disorientation is a key symptom. The person may forget the day, month, or year, or misplace significant events in time, disrupting daily routines. Difficulty making decisions. People with dementia may find it hard to evaluate options and make simple decisions. This can lead to indecision and reliance on others. Social isolation. Withdrawal from social interactions is common as dementia progresses. The person may avoid activities or gatherings due to cognitive or communication difficulties. Inappropriate behavior. Individuals with dementia may exhibit disinhibited behavior, such as making inappropriate comments or engaging in behaviors like aggression or sexual disinhibition. Short-term memory problems. A hallmark of dementia. Short-term memory problems involve forgetting recent events, repeating questions, or losing track of conversations. Hallucinations. Hallucinations, especially visual ones, are common in conditions like Lewy body dementia, leading to confusion and distress. Urinary or fecal incontinence. As dementia progresses, incontinence may become more common. This can cause hygiene issues and caregiver burden. Mood or behavior changes. Rapid emotional swings, irritability, or mood shifts are often observed. These can disrupt relationships and affect quality of life. Placing objects in inappropriate places. Individuals may hide or misplace objects, like keys or clothes, in strange locations, and later forget where they put them. Difficulty planning or solving problems. Simple tasks that involve organizing or reasoning may become challenging. More complex problems may become even more difficult to handle. Total disorientation in time and space. The person may get lost, even in familiar places, or struggle with time-related issues, leading to confusion and anxiety. Repeating questions. Repeating questions multiple times, even shortly after receiving an answer, is another common symptom. This happens due to short-term memory impairment. Understanding the causes and risk factors of dementia. Several conditions can cause dementia, with Alzheimer's disease being the most common. Other types include vascular dementia, Lewy body dementia, and frontotemporal dementia. Risk factors include age, family history, cardiovascular diseases, and an unhealthy lifestyle.